So as you can see, we have a new panel, and this one is very community-based. Over on my far right, I'm going to introduce them anyways, even though you all would all know them, but we have Toby Leon, who's the head of the Chamber of Commerce. We have Belinda Adams, who's our mayor of Labrador City. We have Ron Barron, who's the mayor of Wabush. We have Jordan Brown, who's the MHA for Labrador West. And of course, we have the continuation and of Pat and Sandy here as we talk some more. So we've talked about improving our healthcare system here in Labrador West. We've talked about what it takes to, one, recruit new professionals to our area. The previous panel has talked to us a little bit about some of the things that we can do as a community to help that process. Pat has talked to us about how we can help our community to become healthier and that the demand for our healthcare system becomes something less, so that we don't need probably as many professionals. We take care of ourselves by being healthier people. So the questions will be about that and how we can work together with that. So I'll start with Toby on this one. How do you think, and I'm probably going to have the four of you answer this question, each take a turn. How can the community help positively influence the social determinants of health?
I think that the community really needs to understand our role as a community, that we need to put resources in. I think we've understood this wrong. It's not, I don't think the government's responsibility to do a lot of the things that need to be done in terms of wrapping our arms around the people we want to come here. It's the government's role, I think, to give us the information we need in order to wrap our arms around the people we need to come here. At some point, we have to figure out what our role is in this process and how, and I'm hoping we're going to do that here now. So, you know, and just discussing with Megan about, you know, having learners come here. We don't understand we even needed to do that. You know, we assumed for a long time that government would, you know, just do that if they wanted to. Apparently, we need to take an active role in these things. And so I think we have a long discussion as a community around, you know, what mechanism we use to make the recruitment and retention, and also how we inform at the same time inform government about how unique we are. I mean, I think there's a lack of understanding at government level about how unique our particular situation is in the province. You know, it's not necessarily low income. It's not necessarily food insecurity. I mean, we certainly have a seniors community we need to figure out how to look after, and they'd be probably the most vulnerable in our community. But I think we need direction in terms of how we put together that group, or how we put together the support for the teams we need to build. I'm not sure if I answered it. I don't think I did, but that's what I got out of the last panel discussion, is maybe there's a lack of understanding about what we need. And also there's a lack of understanding in our community about our role.
All right. I'm already passionate out there. I can feel it. Earlier this morning, as a community, for us, when you look at positively influence the social aspect of this, the seniors and youth are our most vulnerable again. And as I listened to Dr. Parfrey and others speak there. I was just taking notes and I realized, you know what? As a community, we actually do a lot. It still can be better. If I look at it, the town of Labrador City donates to every school for the healthy lunch program, every school, every year. The town of Labrador City has a walking trail that we focus on tourism for it. We need to turn that volume the other way and focus on it from a health perspective. The other thing we do is we have silver sneakers in towns from a seniors group. And if you really think about it, we never thought of it probably as a well-being initiative, but it actually is now when I think about it. But now we got to grow upon that and lean on that and grow it even bigger. So if you look at a silver sneakers as a seniors group, with one person leading it, you don't need a title to be a leader, as I said, and this lady took this on. That takes the seniors out in the group, whether it's snowshoeing or working out or whatever it is. So that's part of that. From that, and I appreciate what Clarenville's has done with the accessibility. If you look from an accessibility and getting seniors around to these appointments, these important appointments, I'll up that. The town of Labrador City pays for someone to drive that van to being those seniors. So that's a big win for us to actually be able to do that. So thankfully we are able to do that. This year in the past month, hats off to our Director of Planning and our CAO, we decided, it's the right thing to do, become accessibility in our community. We reached out through engagement and asked for 2 volunteers from the community who were directly or indirectly involved in accessibility. And we started an accessibility planning committee that meets regularly now to see what we can do better to do that for our seniors, our youth, our most vulnerable. So we're doing that kind of thing. So as we were talking, I was thinking, gee, we actually do a lot more than I realized. We have a gymnastics club that's been displaced several times. Same thing. That gets kids out. So how do we get there to get that? We need partnerships to make that happen if they are displaced, that kind of thing. So from a community perspective for the town of Labrador City, we have to be better in partnerships. To Toby's point, we have to be better in these partnerships. If I look out across this audience, I see a lot of people who are invested in that and not probably taking a lot of credit for it. I look out and I see a friend of mine who's a nurse practitioner. I see a physiotherapist. I see all these people here for a reason. They want to do that. So we have to do that. So we have to be socially responsible, but we also have to challenge ourselves when we do that. Challenge ourselves, challenge each other, and determine how we get there. If I look from inclusion and diversity, and it's probably a hot topic for a lot of residents in this community, is inclusion and diversity. We had a Tanya Center was about to go ahead with a lot of money on the table that could have happened for inclusion and diversity. And we probably didn't really look at that close enough to say, this is how we get the well-being with this inclusion and diversity. We missed an opportunity, in my opinion, as mayor. Can't speak for everybody else at the table. But as mayor, I think we missed an opportunity to do that. We were concerned about a snowmobile club path and all that, but we probably didn't have the right people at the table to have that discussion. It was inclusion and diversity. Labrador West was mainly made of Newfoundlanders. And right now we have Filipinos, we have indigenous groups moving to our town. We were talking about doing canning and this kind of thing. So, you know, we have Francophone, we have all that here in our community. So we needed to, that Tanya Center was huge for us. And that's the stuff we need to relook at in the next couple of years to do this well-being. I believe in it. And the players are around the table to get us there. As soon as they started talking about the welcoming, even for the doctors. And I had this conversation with multiple people. When you talk about recruitment and retention for it, we have to do better at getting that. I listened to a doctor talking, Deputy Mayor of Deer Lake, talking about what she does. And if people don't believe in it, it is. Yeah, they have money. It's not about all money. I know for myself personally, a lot around this room, it's the little things. I was in the hospital a couple of weeks ago with my own mother with traveling nurses, and it's all over the news this week. Traveling nurses. I tell you, I was pretty thankful for them the other night. But when I asked them where they were from in BC, I thought they were skiers. And they said, no, I don't think, no, we don't have time. We got student loans. We need to work as much as we can. I said, you interested in going skiing tomorrow? They said, really, ma'am, you would do that for us? I said, no, Toby Leon would though. And he's going to give you a free pass if you really want to go, because you need some work-life balance as well. So that's important. So from inclusion, diversity, and work-life balance, we have a responsibility as a municipality to get that right. And too often we lean on the government officials for all that, but I don't believe it's just one person or one company or one group can do that. It's got to be a combined effort to get that done.
Repeat the question.
All right. How can the community help positively influence the social determinants of health?
Well, you know, Belinda touched on a lot of the stuff there. It's the retention part that I would like to highlight on.
Yeah.
you know, the doctors and the nurses. Do we do enough to welcome them here? Probably not. I know myself, whenever I meet a new doctor or a new nurse, I'm always asking, oh, what's your name, where you're from, and try to get a little to know about them. And actually, I've made numerous deliveries of smoked char and stuff to their houses and that kind of stuff to show that it's not just around Barron, but they get a lot of that from a lot of the community people here, because that's what we do here in Labrador West. You know, we try to work with these people because we know what's been happening here the last number of years with the lack of doctors. And some of the questions that, you know, that I find that we should be asking is basically, you know, with all the med students that we have graduating in our province each year, and I'm not sure if you would know the numbers, Dr. Parfrey or Sandy, you know, how many young people are graduating our programs in the run of a year? 70? So what are we doing to, and I know they're not all from our province, they're all from over Canada and other countries, no doubt. 70 Newfoundlanders? Okay, that's awesome. I didn't realize it was that high. So what are we doing to keep our sons and daughters in our communities? That's the social part that I think we got to be asking, because they're the ones that they know what it's like to live here. They know our lifestyle and they grow up loving it. Now, it's funny that a lot of them, especially here, when they get out of here, they don't want to come back. So what's changed in our communities from now to what it was like when I grew up? Because I tell you what, most people loved it here. You know, yeah, you went away to school and you got to learn a little bit about life outside and the centers out there. But what more can we do here to attract those med students? Because I've seen it in the past. You know, the local doctors taking these med students on skidoo runs, you know, and showcasing the area for them, skiing like you talked on. But there's all kinds of things that they do to these professionals, and not just doctors, nurses too. What more can we do? I'm not sure there's anything more we can do. We can try. I think one thing that should be done is to work with the health board that's here, or the officials that are here, and put a local committee together to make sure that what we're doing for these doctors, nurses that come to our area, we're making sure that we're following up on that to keep them here. You know, and one of the biggest things that I always recommended to make sure that we try to keep them here is bring them here single. Don't have them married. So that's one thing we gotta
I'm with you on
do.
that, buddy.
I don't know if I answered that, but
Relieved in there.
You're gonna get the middle mic there, folks?
No.
Here,
All right, okay, good. Right. Not to like just reiterate with what Mayor Adams and Mayor Barron had just said, we're blessed, double blessed. We have natural resources, but we also have natural resources in the sense that we have hiking trails, walking trails, downhill skiing, cross-country skiing, snowmobiling. Do you want to keep listing? Like we have plenty of things that we as residents we're lucky to have. And I grew up here in Lab West. This is my home. I lived here my entire life. One stint in Goose Bay, but I brought a wife back with me. But in the end of it, when I went to other communities around this province and realized they do not have even close to the recreation and outdoor lifestyle that we have here in Labrador West is thing. So it's a blessing that we have that, and we need to be using that as a way of attraction. But I'm going to go a little further in this and start with the kids that are in our schools. And they talked about encouraging the youth to take up, STEM. So, that's including, science, which would be medicine. And me and Ron had this conversation a couple of years ago, is we want Labrador West residents, Labradorians, to go to med school and to nursing school. We want to encourage them to do that because someone who's going to come back here and understand Lab West, and it is it's cold in the winter. It's a different place to live. We understand that, but maybe it's time that there are communities to get together, Lab City, Wabush, community stakeholders and business partners stuff. Maybe it's time that we start actually having a grant or tuition program to put our own through med school. It's very expensive. And I'm sure the doctor right next to me understands and probably nodding that, it's very expensive to put a child or a young adult through med school. So maybe it's time that as a residents, as a group, we put together and actually start helping the youth here that want to do these things, who want to be doctors and nurses, that maybe there's a grant program that maybe Labrador West can create internally, that, someone who graduates Menahek has the opportunity to live their dream. Because sometimes, not every parent can take out all that money. And that's maybe that's another thing that we as a community can do, is actually start helping our own go to med school.
Yes, go ahead. Yes.
There is a kind of difficulty with what you'd like and what's going to happen. Insofar as it's quite common from a medical student to come from a smaller community and go to medical school and decide they want to be a pediatric nephrologist. And the only place they can be a pediatric nephrologist is in Toronto. Or they choose to be somebody. I know a woman from Stephenville who came to medical school and she chose to be an endocrinologist. The only place she could work was in St. John's. So a minority of them, the way it's set up, medicine is that the doctor has the choice. They make a choice at the end of their training to say whether they'll be a family doctor or a specialist. A minority become family doctors, so let's say 35% maybe. And they're the ones who are much more likely to stay in Newfoundland than the ones who go into specialty medicine. But those people making their choices who come from, say, Lab City, you're a bit limited. So one of the things I've often wondered about is if you're going to go through medical school and you're getting your tuition subsidized, should you not have a return of service so that you should work in the province for a number of years? That's been rejected on multiple occasions because it's considered to be an impingement of the rights of the people who are actually going into medical school. But it's a bit more difficult. It's a bit more difficult to get the return that you'd really like.
It'll take you 7-8 years before you see the fruits of that labor.
I'm curious, Dr. Parfrey, who's decided, and I'm not suggesting that it's wrong. I'm just wondering who's decided that it's an infringement on people's rights. Is this a legal thing or a moral thing at the medical school level or at the court level?
No, it's at the personal, it's at the Canadian medical schools feeling that students should have the right to choose what they want to do. So that's
from at our level, and I'm not not ready to get into a moral argument about it, thought a lot about it, but our money, our offer should have some moral sway as well, and I guess it's just a thought, and it's not somewhere I want to keep going with this. It's just a thought. And I was curious about where it came from, and yeah, so
Maybe the question.
that's not, I think it's
but-
moot at the moment, but
Maybe the question is you ask those students to make that decision a little bit earlier on in their process. Right? So if you would like to have this money, this is what you would do. You're making your own choice. I'm not sure.
if I get it correctly, the school doesn't accept that position, and again, I think it's moot at this point. I think it was just a thought.
And it's fun having three mics going at the same time. Ron, you made a good point there. Maybe we need to do a 360 effort and look when we have a doctor here or a nurse here, and we go and we have a group here that can go back to them and say, what's working well for you, what's not working well for you. So the next question I'll ask you folks and challenge you folks is, what are the first steps in developing a welcoming community for healthcare workers? And it might not just be healthcare workers, because as soon as I start thinking about these questions, I'm thinking about, well, when I want a mining engineer to come and stay here, when I want a businessman to come here, and we want people to come here and stay who are professionals in any field. What are some of the things that the community can do? What are the steps that we can build into having a structured process? Not just, well, we do this is nice, that's nice. This is what can we put together that's a structured process that we're going to do each and every time, step by step, to make sure that these people feel included. Yeah, go ahead, Belinda, you start this time.
Yeah.
You see? I guess we're right back full circle to what this summit's about. We're right back for full circle to incentivize. We can put them in grad school. We got no housing. If you look at the community, when we went to arts and culture with the community and we asked them to vote, if housing or healthcare is most important, it's probably 50-50 on what they thought it was, because it all goes hand in hand to connect to that. So for me, there needs to be a well-being team. If you look at the accessibility plan team and the engagement we brought out in the community, and there has to be a well-being team and whatever that looks like. And I challenge anybody here today to be on a well-being team and see what that looks like, because we have to have housing for them. If I look at, not sure if I'm speaking out of turn, but it would be my first time, I guess so. It is what it is. If you look at from incentivize, when I came back from that thing and councils had multiple debates, especially at budget time, how do we incentivize? How do we get people here? If I look at the college, and I use this example, when I looked on Facebook, I look at the college, I look on Facebook for a kid who came in from Newfoundland to do his, I think it was millwright welding, whatever it is, looking for a ride in 50 below because he had to walk. So we have no public transit, but we also don't have any residents on our college. So how do we get there? If you look at the Iron Ore Company of Canada is very good to this community. And back in the day, as I discussed earlier this morning, in 70 years ago, they built this community and put everything that's here. So we need support on getting more here and whatever that looks like. The Iron Ore Company of Canada is still good to the town of Labrador City, whether it's our operating budget or whatever it looks like. And recently they've reached out and said, are you interested in, jointly managing a couple of houses and what that looks like from a professional? So back to your point, Ed. So professional, what is a professional? And someone says, well, we had 10 teachers openings there last fall and that one person applied, so it's not the money. I still beg to differ. Did we reach out and have that discussion with them and see what the root cause is? And do they know where Labrador West is? A lot of Labrador doesn't have a good reputation because nobody's been here to see what it really is about. Nobody understands Labrador to see and understand what it's really about. I could look around this room and know about 60 people and 40 you came here to pay off a car or to get your journeyman and leave and you're still here. And that's where our community is. I would say I challenge Justin there from the International Union to say most steelworkers came for the same reason over the years. And I'm sure I wouldn't get a debate. So how do we get to the root cause of why they want to be here? So if you look at from a housing perspective, and again, we haven't committed to nothing, but it's a start to have those conversations. So if you look at from a community perspective and we say, okay, we got professionals. So you reach out to a young student who's just graduated and wants to be a teacher. So you say, okay, why do we get you to Labrador? Oh my God, what's Labrador? I'm only 22 years old. I lived in Cobbles Cove all my life. I don't even know what Labrador is. And you got 50 below. That's terrible. I'm not coming here. So you bring them out for lunch and see what you do and ask them. So then you say to them, we can put you probably up in a bedroom. We're not sure what it's going to look like yet, but we may be able to have a room for you. And you're not going to pay very much rent, or you may pay a lot of rent, but guess what? Do you want a trail pass for the winter or whatever that looks like? Because we've formed these partnerships to make that happen and see where it's to. We're not Toronto, we're a community. And then that student goes, gee, it's worth a visit, I guess. I can think of, he was here earlier, it's not gone, it's Pete McCormick. I was in grade 12, so you're older than me, Pete. And him and his wife had moved here the same way. And he said to me, his wife was still in Corner Brook finishing her degree. So I'm only here to get her through. And I remember that conversation. I was 17 years old. He said, I'm only here to get her through. When she gets through, then we're going to see. I think she's coming up for a teaching job too, Belinda. That's pretty cool. Guess what? He's graduated. He's retired, both of them. I think she is. I know he is for sure. She's still teaching. Again, still, I'm only 29, so I've been out of school long, just saying. But a long time ago, but they're still here. I'd say 90% of the teachers are here for that reason. Tom Costello told me himself, he's from Belle Isle and he didn't come here to stay. But we sold it to him. And that's what we got to do. So I challenge anybody here to be on the well-being, like on that committee, and we find the root causes and we do it together as a team and how we incentivize and get it here. They're not all out here. We have to convince them to come here. If they don't like snow, well, we need to maybe think about that Tanya Center or what it looks like for inclusion and diversity. We may have to look at that. But there's a lot of players who want to play and beyond this. So that's the idea of this summit and bringing that full circle so we get there. And we really need to make that happen. Because guess what? You got 2 doctors and Harbor Grace does a wonderful job, you said. So Harbor Grace goes after them when we go after them. Where do you think they're going to go? They're going to Lab City because we're going to be the champions.
Kudos to IOC. You talked about what more can you do for when you bring professionals here, whether it's doctors, teachers, whoever, but with you guys, I know when you bring your employees here, One of the things you done, you brought them around. You showed them the rec center, showed them what they could have. I'm sure you brought them up to the hill and showed them the skiing facilities and all that stuff. So that's the kind of stuff that we can do as a community, or even the health board. We make sure that we showcase area what is here to offer you. But one thing now, I'll throw a brick at the same time at the companies. One time, they used to have little incentives to the schools here and the hospitals, and they gave money to those groups to help attract people here. The incentives are there now from the government, and very hefty signing bonuses, by the way, if you sign on for 2 and 3 years, that's fine. But what more can we do to incentivize those people staying here? Here, I think we've done everything we can. I know one-time housing was given to the doctors here. They also had the little practices off to the side for doing the medicals and all that kind of stuff. So there was extra monies they made there. It got to be very frustrating for the residents. I know myself, I just recently went through an issue, seen 4 different doctors running 2 weeks up at the hospital here. Now, each time I had to explain what was going on. And, it slows the process down, especially when your waiting room's full of people. If you've seen the same one, well, hey, I'm back because of what I was here before. But I'm sure they're frustrated as hell. The doctors and nurses, especially, it's just repetitive, So I'm not sure what more we could do, Ed. We can throw everything at them. It seems like we do, even with the incentives we're throwing at people to sign on for 2 and 3 years, still can't get them. So, and these are doctors from outside. I'm still adamant in the discussion that you brought up again there, Jordan. Let's grow our own. It's going to take time to see the fruits of that labor. But little Johnny and little Susie, I guarantee you, they're in our schools that would gladly go to med school if they could, with the means provided for them. But again, comes back to you. We just gave you 7 years. You got to give us 7 years back at the end of it. And if you got that started, every year you got an extra doctor. Now, we don't have a place to fill. Well, they can make a choice to go elsewhere. But right now, that's the way they should be set now.
It's just a big commitment for a work-life balance.
Yeah.
Expect someone to sign on for 7 years, and I think that's
Well,
a
they
lot to
don't-
ask.
Perfect. Thanks, Ed. And I'll read this is, we got the recruitment side and we also have the retention side. So we do have healthcare workers that are currently working in the system right now too, that we also have to continue to follow up with as well, to remind them, that we appreciate what they're doing and we want them to continue to work in our communities because, they have, it's a global competitive market right now that they also have the ability to pick up and leave. So we have to remind people and remind the community that we appreciate what they're doing, and remind that we have to build a work-life balance for these people as well. So another great thing with recruitment is seeing what's already in a place as it is. Sometimes it also helps in recruiting as well, as they say, oh, the up in Lab West, the nurses and doctors up there, they got this great work-life balance, everything like that. Then you start luring people into our own community. So it is a possibility. So when you look at professionals that are up there now, is, we treat them with the absolute respect and everything like that. And we're also same thing, make sure that, do you have a ski pass? Do you have a skidoo pass? Do you have this, we can incentivize the ones that we have here now, because it eventually will have fruits of its labor and luring other people to come up as well and realize, oh, this is a great place to work. And we have to create a balanced workplace for these people as well. Another thing too, is we talk about, well-being and stuff like that. And we talk about housing and affordable housing. Currently right now, if, someone who's a professional, either, a doctor, a nurse, or even, some of the techs and stuff like that we do require coming out of school, and we want them to come up here, even if they, there's some housing provided, we can't, there's going to be individuals that we won't be able to provide houses for. So, you look at your techs and and other people that work in the hospital, they come out of school, they can't afford a $260,000 mortgage right off the bat. They have to build up to that. So right now there's nowhere affordable for anyone to rent. You have an X-ray tech, there might not be a place right for them to afford to rent to come up here, an LPN right now, right? They're priced out of the market right now in Lab West. So affordable housing does fall into this equation. We have doctors, we have nurses, But we have other people at the hospital, there's roles that have to be filled as well, and they're professionals. And we have to make sure that they can afford to live here as well. They're treated with absolute respect. And that because even when they're happy and they're working, and they will tell other professionals, even in different professions, of how great it is here. That might lure a doctor, a nurse, or someone higher up as well. So we got to look at the big picture of the whole like ecosystem that is our healthcare system and working at the hospital, is that there's a lot of people in there, and we have to make sure that each and every single one of them that's working in there wants to stay working there. So yes, we have doctors and nurses, we got to recruit them, but we need lab techs, we need x-ray techs, we need custodians, we need maintenance workers. We need all these people to make a workplace ecosystem that is up there that people want to come to work at, people actually want to stay and work at, because we want to go back to the sense that, we want people to, I know in the current kind of job market, you see people only sticking around in places for 10, 15 years. But I rather like to see a nice hospital where someone says, you know what, I like it here. I can raise a family here. I can put my 30 years in just like everybody else did in Lab West. I came here, and Belinda mentioned the point there. My grandfather came here in 1959. A guy outside of I think it was the old post office down on Water Street in St. John's, handed granddad a flyer and said, "Hey, are you up for an adventure?" And grandfather said, "Sure." And my grandfather came up here on a Norseman with skis and landed out on the lake out there in 1959. I'm here. Dad's here. I'm here. I have 2 children here. I'm not going anywhere. And hopefully I can convince at least one of my 2 children not to go anywhere. So I think this is a big picture as well as, an ecosystem of healthcare. And we have to look at affordable housing for those who need it, that, it may not be covered under, a house for a doctor or a house for a nurse, but, there's people that work in the hospital that need affordable housing. You have to talk about a workplace life balance. You can't be doing 12-hour shifts and expect to go back in for more 12-hour shifts. You need to, they need some recreation. They need some downtime. They need to see all this. So I think, when Mayor Adams talks about a well-being coalition, absolutely, 100% agree. I think that's a great way to start this, but we need to look at the big whole ecosystem of everybody that works in the healthcare system.
I'm going to ask our professionals here a little question. In my life as a consultant, one of the things I encourage my clients to do is to benchmark. Go see who's good at stuff, and then see if you can take some of those ideas. Do you guys have some understanding of who's really good at this? Is there communities in our province or in Canada that are really good at this? And is it, maybe that's an idea for us to go and see what good looks like?
Good looks like having a. Hello, can you hear me? Good looks like having a leader, particularly a medical leader, who's able to get out into the areas that these doctors are working in or training in, and persuading them to give it a look. Getting the look is important. I'll give you an example of my own personal story. So I came to Montreal in 1982 and did a nephrology training fellowship. Was offered a job in Montreal, which I was going to take, and I was called by the kidney doc in St. John's, and I said, I have no interest in going to St. John's. I want to work in a big teaching hospital. And 2 months later, he rang me again. I said, I have no interest in working in a small university. I want to live in a big teaching hospital. 3 months later, he rang me again. I says, for fuck's sake, I'll go down there. So just to get him off my back, I went down there, and 2 days later, I said, I'll take the job. Right? It was just something hit me about what it was about St. John's that I liked. And what you need to have, I think, is let them see what it's like, except that they'll only stay for 2 or 3 years. That's what you're going to get. But every so often you'll get somebody who says, I really like it here. Because you're not going to get 100%. It's just not going to happen. So you've got to cut your cloth a little bit. So that it's that touch that you need to get, and that's your biggest problem, because you're not having people applying for the jobs, getting that touch. And I think you could, right? You could set up a system to be able to touch those medical students that are in St. John's, to be able to give Labrador City a chance.
So you have these students down in the school. Would it be wise for us to take them out of school midterm and say, look, we're going to give you guys a trip up to Labrador, come and have a look, and we'll show you around, and we schmooze them for a day or two? Is that something that you might want to think about?
current leadership we have here in the community with the municipalities is we can create a venue where we can have an opportunity to speak to the healthcare providers that are in the hospital currently. You know, and as MHA Brown pointed out, it's not just the nurse and the doctor. And as I said earlier, you know, it's not just the nurse practitioner and the doctor. It's oftentimes people need different providers, OT, physio, dietitian, social work, the list goes on and on. So I think it's about us now, you know, one of the takeaways from this forum, if both municipalities are interested in, is us giving you space to consult with the folks that are inside our facility now working to learn about, you know, what is going to keep them here. Because as my friend and colleague on NLHS pointed out earlier, Debbie Malloy, it's about, you know, how do you keep them here? How do we, you know, not that you want to, what's the word, capture them and never let them leave again, but it's about how they stay. What keeps them here? Why do they want to stay here? I mean, Pat just gave an example. I'm another good example. I was born and raised in Newfoundland, and I moved here after graduating as a social worker because this is where I came to go to work. And 31 years later, I'm still here. And, you know, I have intentions, perhaps different intentions for retirement, but I would never, ever have changed one thing about staying in this community and in this zone.
So I do think you need to be innovative in how you connect. Like these recruiting trips occur to other countries. I was on a recruiting trip, and we had 5 applicants apply for our our family practice training program from where we went to. It worked actually, right? Which was a bit surprising. To me, it was surprising, but it worked. So it's somehow getting their attention to give you the time of day. And then when you get the time of day, some of them become attracted by what's on offer. And Happy Valley Goose Bay is a good example of that, where they get people going to NormEd and they stay. Not everybody by any stretch of the imagination, but enough.
Good. You know, I know in the past, when you visited your local doctor, there was always med students there. That's something I don't think I've seen in a long time. Maybe I'm just not seeing them, but how many med students have we had here in the past number of years that we can showcase that? Because I know, like, I'll use Dr. Costello as an example. I mean, that guy used to take them to the cabin on Skidoo and do their thing. And, you know, they were always at it. A number of them did it to try to showcase area. So are we bringing them in here still, the med students?
So not so much in Lab West, Ron, but I mean, you just named Dr. Tom Costello. So he was, you know, very, very interested in having med students with him. I'm not saying the doctors that we currently have here now aren't interested, but I know Tom was real strong in terms of bringing, you know, having students work alongside of him. But it is certainly something that we can have a conversation with about the current group of physicians that's here now. And, you know, the most recent physician that joined the team here in Lab West, she came through the PRA program in Goose Bay, and he moved here. There was 2, the female didn't, the male did, right? So, you know.
So we'll clue things up here with the panel. And again, I want to thank you for your interaction. Some very good things. I think some of the key points we wanted to take away is how can we look at our community and how can we support the medical system to recruit and retain a lot of these workers? How can we be a part of that process? Some good ideas come up. Yes, Toby.
You know, I look around here and you know, we filled this room with people and we're having conversations, I think good conversations. I don't think we can download the next conversation on volunteers. I think we need to figure out what the process looks like to, you know, the reason this room is full is one person. I opened my big mouth, but one person made this happen who was full-time actively doing it. And I think we have to understand that as a community, as two towns and through 50 companies or whatever it is, we have to find the resources to get the person to drive this next phase.
I agree with that too. So we'll capture that as one of the actions for the end of the conference. In terms of a little bit of housekeeping, we have our event this evening at Smoky Mountain. This is a ticket event that requires RSVP. If you are not sure if you are on the list for that, please check with Lydia on your way out. And if you need a ride, also please check with Lydia. You'll see on the agenda there that there was a table activity. Of course, with the announcement earlier today, we got extended quite a bit, so we got stretched a little bit with time. But again, don't think that the conversation just stops here on healthcare. If you have further ideas, further suggestions, please reach out to your leaders here. They will gladly take your suggestions and take them further. This is just to get that discussion rolling, get us thinking in terms of working together, getting us prepared that something bigger and better is in front of us if we do it the right way. So thank you very much for today. I really appreciate your time and work.